Second topic I read today is brachial plexus. Brachial plexus formed from ventral rami of C5 to T1. If C4 is involved, then it is called as prefixed. If T2 is involved, then it is called as postfixed. So ventral rami of C5 and C6 is fused to form the upper trunk. C7 will continue as middle trunk. C8 and T1, the ventral rami will fuse to form the lower trunk. Now each trunk is divided into anterior and posterior division. The anterior division of the upper trunk and the anterior division of the middle trunk will fuse to form the lateral cord. All the posterior divisions will fuse to form the posterior cord, and the anterior division of the lower trunk will form the medial cord. Then the branches from the brachial plexus. Number 1 is dorsal scapular nerve. Original root value is C5. It will supply levator scapulae, rhomboides major and rhomboides minor. Levator scapulae will help in elevation. Rhomboides major and rhomboides minor will cause the retraction. Retraction is also done by trapezius. Next nerve is long thoracic nerve, which is known as nerve of Bell or nerve to serratus anterior, which is known serratus anterior is boxer muscle. Injury to the long thoracic nerve will cause the whinging of the scapula, but if there is whinging of the scapula at the wrist, then there will be trapezius injury. Then nerve to subclavius, root value is C5, C6, and suprascapular nerve, which will supply supraspinatus and infraspinatus. Then branches from the cord. Lateral cord, mnemonic is Laila loves Manju. LLM, lateral pectoral nerve, lateral root of median nerve, and musculocutaneous nerve. Medial cord, the root value is C8 to T1. Mnemonic is 4MU. Medial root of median nerve, medial pectoral nerve, medial cutaneous nerve of arm, and medial cutaneous nerve of forearm. The root value of all of them is C8 and T1, except ulnar nerve. Root value of ulnar nerve is C7, C8 and T1. Ulnar nerve gets a component from the median nerve, hence root value is C7, C8 and T1. The posterior cord mnemonic is ultra. Ultra, U for upper subscapular, L for lower subscapular, T for thoracodorsal or nerve to latissimus dorsi, which is known as climber muscle, R for radial, and A for axillary nerve. And the root value of the axillary nerve is C5, C6, and it will supply the deltoid and the teres minor. So problem, if there will be axillary nerve injury, it will cause paralysis of both the muscle and problem or loss or weakness of the abduction, and it will also cause the Regiment badge sign, sensory deficit of the Regiment badge area. Regimental badge sign will be seen, loss of sensation in this area. Then injury of the brachial plexus will cause Erb's palsy and Klumpke's paralysis. Erb's palsy is upper trunk palsy. It is C5, C6 injury, and common in newborn due to shoulder dystocia while delivery, loss of abduction and external rotation. So arm is in adducted and medially rotated position, and forearm is extended and pronated position. This is known as policeman T-Fant deformity or waiter tip deformity. So arm is adducted and internally rotated, elbow extended, and forearm is pronated. And then Klumpke's palsy. It is lower trunk injury, C8, T1 injury. It will cause claw hand deformity and Horner syndrome. Horner syndrome due to T1 sympathetic fiber, intrinsic muscle of hand deformity. And when T1 is predominantly involved, it will lead to Horner syndrome, will cause ptosis, meiosis and anhydrosis. And this is the image for claw hand, and it is showing bursting of the forearm muscles.